Hello, the following presentation is an overview of HIV presented to CCBC nursing students in Concepts 2. The cardinal symptoms of an immunodeficiency are recurrent or chronic severe infections, infections by unusual organisms or organisms that are normal potentially to body flora, poor response to standard treatment for infections, potentially chronic diarrhea. In addition, the patient is susceptible to a variety of secondary disorders. Here we have the structure of an HIV cell and also the life cycle of the cell. You see that there are 8 different stages to the HIV cell. In stage 1, the attachment of the HIV virus to the CD4 receptor. Stage 2, there is internalization and uncoating of the virus with viral RNA and reverse transcriptase. 3, reverse transcriptase then produces a mirror image of the viral RNA and double-stranded DNA molecule. 4, there is integration of the viral or changed DNA to the host DNA using the integrase enzyme. 5, transcription of the inserted viral DNA produces a viral RNA messenger. 6, translation of the viral messenger RNA is used to create a viral polyprotein. And then 7, and on the screen it'll be 7 and 8, cutting of a viral polyprotein into individual proteins to make up the new virus. And 9, the assembly and release of the new cell from the host cell. There's also a video within the lesson plan that will show you an animation of the HIV life cycle. It's important to understand the various steps within the HIV life cycle because they correspond with the different types of medication that a patient may get. Just as antibiotics work according to the cell cycle of the patient, HIV meds also will work according to the cell cycle. So the incidence and prevalence. I'd like you to review the incidence and prevalence data from the CDC. You notice that all groups are listed. The fastest growing population are African American teens, followed by African American heterosexual females. If you have sex or you do IV drugs, you are at risk for HIV. Everyone that falls into those categories of being sexually active or actively using IV drugs falls into the at-risk category. However, there are some populations which are at a greater risk for HIV. Transmission. HIV virus is transmitted through blood, seminal fluid, vaginal secretions, amniotic fluid, and breast milk. Note that it does not say that it is transmitted through diarrhea or that it is transmitted through sweat or through tears. Anytime there is blood present, there is a potential for the HIV virus to be in that blood. Lifespan considerations. First, we talk about adolescents and young adults. So adolescents and young adults are at a greater risk because this is usually the area of first sexual contact. Sexual transmission accounts for most cases of HIV during adolescent years. The HIV disease rates have increased among 13 to 19-year-old African Americans in this age group. There's a growing number of female adolescents and young women with HIV is reported to be a result of heterosexual intercourse with an infected male. HIV infection has also increased in 16 to 19-year-old age groups, especially when young black male adolescents and a young black male engaging in sexual intercourse with men. So men having sex with men is also a high-risk group. So if you think about lifespan considerations, we have to go back to our mental health course and think about feelings of belonging and acceptance and where they are in Erickson or Piaget stages to understand if they are at a risk for being sexually active and what are the core reasons or core needs that they have. They feel that they're being met through sexual intercourse. Children less than 13 years old, HIV cases in children less than 13 have decreased due to highly active antiretroviral therapy in the prenatal and postnatal periods. Infant and children should still receive all vaccines. It should depend on what their we call them their counts. So what their immune status is, what their viral load is, what their CD4 and CD8 counts are, as to when they would get the vaccines. However, these young people have a decreased immune system, so we want to protect them from any type of disease that can be prevented. Overcoming barriers for the plan of care. At the completion of home care instructions, the patient or caregiver should be able to do the following things. This is an idea of how to engage your patient in their plan of care, include them in their plan of care, and we do know that from the idea of perceived engagement, when a patient perceives that you are engaged and you care about them, they're more likely to follow with the plan of care. So some examples of how you may individualize the plan of care is patient verbalizes knowledge of medication, they can state the action of the medication, state the correct times the medication be given, they can follow the guidelines for the medication. You want to look at what specific meds they're taking and what specific timeline do those meds need to follow based on what their life is. When we talk about medications, we'll talk about the idea that a lot of these medicines have considerations that go with them and stipulations that go with them, so the patient has to understand the medication and be able to fit it into their life. There's a chart 57-2 that has some really good suggestions on how you can individualize a patient's plan of care. Interdisciplinary care. So one of the things that the interdisciplinary team does is they help identify infection early. When we talk about infection, when I say infection early, I don't mean the HIV infection, I mean subsequent infections that could be life-threatening for the patient. They promote health maintenance activities to prolong the asymptomatic period as long as possible. We do know that when a patient is healthy and has HIV, that their asymptomatic period can be many years because they have a good immune system. So all the things that we're going to talk about with our immune lecture, as far as a healthy diet, exercise, rest, decreased stress, feelings of love and belonging, and we go back to our psychosocial health as well. All of those health maintenance activities help prolong the asymptomatic period. Prevention of opportunistic infections. So opportunistic infections are infections that our patients get when their CD4 count is low and their viral count is elevated. And how you prevent opportunistic infections is they take their medications on time and appropriately. They have regular health maintenance checkups, and they engage in health maintenance activities such as decreased stress, good diet, sleeping patterns, etc. Treatment of disease complications such as cancer. So everyone has cancer cells roaming around in their body. They're just mutated cells. And when you have a impaired immune system because of HIV, it doesn't recognize those cells as foreign and allows them to grow. So patients that have HIV are at a higher risk to have cancer. We treat patients that have HIV, we treat their cancer just as we would treat anyone else's cancer. When I worked at a hospital and worked on their oncology unit, we did have a patient who was HIV positive who'd been treated for several reoccurrences of leukemia as well as cervical cancer. And she was healthy for many years, but as soon as her immune system started to decrease, it allowed those malignant cells to regrow, and she did have leukemia as well as cervical cancer. And we do treat those cancers. Also providing emotional and psychosocial support, understanding if the patient needs counseling, if they should join a support group, if there would be a potential need for family counseling. Prevention. So the first step in prevention is education. educating our patients and our families and our community related to the ideas of if you are sexually active or if you use IV drug use, you are at risk, and ways to decrease those risks, which would be safe use, no IV drug use, and monogamy within relationships. This website here, hivtest.org, if you put in your zip code, it'll actually give you all the places that will do HIV testing for free or at a minimal cost in the area. So you can use that tool to help your patients find a place to be tested. Counseling. They may need counseling on addictions such as a sexual addiction or a drug addiction. So we need to keep that in mind, that we may need to write referrals for counseling, and identify possible barriers to testing. There's usually a reason why people don't want to be tested for HIV. They feel like they would cause problems with their family or cause problems with their partner. So we need to identify what those possible barriers are. And these are potential topics for community care education. We can do education to large groups within the community. Safer sex practices, rest, nutrition, exercise, stress reduction, and lifestyle changes. That would be in order to prolong the asymptomatic period. Appropriate hand washing to prevent the spread of infection. Also to help increase their immune system, or decrease their immune system from getting common viruses like the cold or the flu. Medical follow-up as needed. Signs and symptoms of opportunistic infection. So there's going to be a lecture about opportunistic infections, so to identify the signs and symptoms and pass the information on to the general population that is HIV positive. Medications and adverse reactions. The heart therapy, there are several classifications within the heart therapy, and they have lots of side effects that go along with them. So that's a good patient topic area. And the reason we like to give information about those adverse reactions or adverse effects is because when they have the adverse effects, they usually stop taking their medication. When you stop taking heart medication or don't take it correctly, heart is highly active antiretroviral therapy. When you stop taking or do not take your therapy, antiretroviral therapy correctly, it causes the virus to mutate, and it's harder for us to kill the virus and to keep the HIV infection under control for the patient, as well as anyone that patient may transmit the virus to. Then we have a hard time controlling the virus in other hosts or other patients as well. Cessation of smoking, alcohol, recreation, or illicit drug use. That all of those things, as we learned from our concept immunity lecture, decrease your immune function, the use of tobacco, alcohol, and drugs, and then any home health services in the area that may be able to be used for the HIV positive patient. Prevention at work. So no standard precautions. Standard precautions should be for everyone. Know your patient's status. Report your patient's status. But we should only be reporting our patient's status to those who would come in direct contact. For example, if you're giving report to your tech or your nursing assistant, they should know that your patient is HIV positive because they have the possibility of coming in contact with blood from them. However, the person that is delivering their tray does not need to know that they're HIV positive, or the transport person that may be taking them to an x-ray does not necessarily need to know that they're HIV positive, because we're supposed to treat everyone that's HIV positive with standard precautions just like we treat everyone else. There's actually been court cases surrounding patients who were isolated for being HIV positive and not having an opportunistic infection. So when you have a patient that comes into the hospital and they just have HIV, they're not to be put on contact precautions. We are to use standard precautions. If they have MRSA, or if they have VRE, or if we're trying to rule out TB, then yes, those patients should be placed on the specific type of precaution for those organisms. HIV in itself does not require any type of special precaution. Want to follow the facility's procedures and guidelines for blood draws and reporting any potential sticks or spills.